Hello everyone, my name is Soto, and this is my presentation on my project titled Hypertension Control and the Use of At-Home Blood Pressure Monitoring. Just a little bit about myself. I am currently an FNP practicing in a primary care clinic. These are my DNP committee members, with my chairperson being Dr. Jennifer Hopner, my community person being Willa Giorgio, and my second reader being Dr. Jennifer Brunsworth. I would like to take this opportunity to thank my DNP committee for all of their support and help throughout this project. Significance. Hypertension is a large concern not only in the United States but all around the world. Approximately 50% of adults have hypertension, and only 25% of those adults have it under control. Uncontrolled hypertension can lead to many health risks, such as stroke and heart attack. Hypertension is often underdiagnosed and is often due to a lack of access to health care. Uncontrolled hypertension can also be associated with medication gaps due to lack of consistency of follow-up visits or a lack of access to healthcare overall. Some of the current medical standards are high blood pressures are considered controlled when blood pressures average 130/80. And some shocking statistics. In 2017, hypertension was the leading cause of death worldwide. Another interesting fact is that in the United States, hypertension costs the United States health system an average of $131 to $198 billion annually. Considering all this, finding a solution to address this problem is important. One solution that could possibly have a large impact on these issues is the implementation of at-home blood pressure monitoring. This project aimed to increase the number of patients monitoring their blood pressures at home to hopefully enhance hypertension management in a primary care setting. Some of the aims of the project were to, number one, evaluate if at-home blood pressure monitoring improved patient ownership over their health as well as their hypertension management, and two, if it increased medication compliance with hypertensive medications, all resulting in better hypertension management. My DNP question. So my PICO question was, in adult patients in a primary care setting diagnosed with hypertension, is the use of home blood pressure monitoring better than not using home blood pressure monitoring? Before the project's implementation, a literature review was conducted to identify hypertension management strategies. One of the themes that was identified during the literature review was blood pressure management in a primary care setting. It was identified that engaging patients early on in diagnosis and in their hypertension management, encouraging these patients to implement at-home blood pressure monitoring helped to improve overall hypertension, leading to better health outcomes. This also increased medication adherence. During the review, managing hypertension in a federally qualified healthcare clinic, also primary care clinics, also helped improve overall health outcomes. Another theme identified during the literature review was the discussion of patient outcomes through hypertension management. Through the literature review, it was found that through effective hypertension management, there was a reduction of overall hospitalizations, as well as some of the cardiovascular events were decreased because of better hypertension management. This overall resulted in enhanced quality of life. Patients also had healthier lifestyles because they were receiving education on how to better manage their hypertension through diet, lifestyle, and and exercise. Another theme identified from the literature review was non-pharmacological interventions for hypertension management. It was found that through increasing patients' interactions with their provider, now this could have been either through a telehealth visit or through in-person visits, allowed for providers to increase their education with their patients on diet, lifestyles, and other risk factors to help improve hypertension overall. This was found to help decrease blood pressure overall, thus improving cardiovascular health. The last theme identified during the literature review was incorporating at-home blood pressure monitoring in hypertension management. During the literature review, it was found that through the use of at-home blood pressure monitoring, patients were able to be more engaged in their treatment plans, which allowed them to have more ownership over their health, which also increased medication compliance. This also resulted in a trust being built between the providers and the patients, improving the communication between the two. The patients felt like they were able to communicate with their providers some of the concerns they had, and thus having them be more invested in their overall health. All of these helped to improve overall health, like I previously stated, and reduce the risks associated with uncontrolled hypertension. Theoretical framework. The model that helped shape this project's theoretical framework was based on Becker's health belief model. Becker's health belief model states that behaviors are driven by the desire to prevent and cure illnesses and the belief in the efficacy of actions. The project identified with the following key constructs. The first being perceived susceptibility and severity. It related to this construct because the project increased awareness of the risks associated with hypertension and helped to increase patient engagement. It related to the key construct of perceived benefits and barriers because the project helped the patients recognize the benefits of managing their hypertension better, thus motivating them to overcome any barriers that may hinder this. Lastly, it related to the key construct of cues to action and self-efficacy because it encouraged patients to monitor their blood pressure and promoting ownership over their overall health, which helped to foster proactive management of their hypertension. The goal of the project was to increase at-home blood pressure monitoring to help enhance hypertension management in a primary care setting. This project aligned with the public health initiatives demonstrating the health belief model's effectiveness in improving patient compliance and health outcomes. The methodology of the project. The project was a quantitative exploratory design using retrospective chart review. The project was conducted in a federally qualified healthcare center in the western region of the United States. A convenience sampling was conducted to obtain the 60 patients included in the project for chart review. The charts were reviewed for both pre- and post-intervention blood pressure readings. As previously stated, the sample size consisted of 60 patients overall in the beginning, with one not having a post-blood pressure reading, resulting in a total of 59 patients, charts that were reviewed for both pre- and post-intervention blood pressure readings. There were a total of 32 males and 27 females. The blood pressure cuffs that were utilized for this project were all donated from the American Heart Association, and as a result, all of these cuffs were standardized, and each patient was able to get one that was working effectively and was deemed safe by the American Heart Association. The patients who were given a blood pressure cuff met the following inclusion criteria. They were adults over the age of 18, and they had a hypertension diagnosis. Some patients who did not meet the inclusion criteria and met the following exclusion criteria were not included in the project. These patients were patients under the age of 18, and they did not have a hypertension diagnosis, or they had a hypertensive crisis diagnosis. Patients that were also excluded were patients that had a recent admission to the hospital due to hypertensive crisis. The data retrieved from the project was analyzed using descriptive statistics that were quantitatively summarized the data to identify patterns used to here assess the intervention's effect on systolic blood pressure reading within the sample group. With this data, a paired t-test was used to determine if there was a statistical significance between the pre-intervention blood pressure readings and the post-intervention blood pressure readings. The results of the paired t-test showed that there was a significant improvement in the post-intervention blood pressure, with the mean blood pressure being 124.51 with a standard deviation of 9.39, compared to the pre-intervention blood pressure readings, which were an average of 132.32 and a standard deviation of 12.09. With the mean difference of both the pre and post-intervention blood pressure readings of a 7.814, indicating that the effectiveness of the intervention. Here are a few histograms to show the change that occurred due to the project's implementation. The first histogram to the top left shows the patient's pre-intervention blood pressure readings. Now you can see here that the systolic readings are widespread, and many of them are over the 130 range. The second histogram to the top right shows the post-intervention blood pressure readings, with many of them being between 120 and 140. The last histogram to the bottom shows the change in blood pressure that occurred due to the project, with an average change in blood pressure resulting in an average drop of 7.8 millimeters of mercury in the systolic blood pressure reading. Interpretation of the results. So what does all of this mean? The average pre-intervention blood pressure reading was 132.2, and the average post-intervention blood pressure reading was 124.5, showing an average difference of 7.81 millimeters of mercury from the systolic blood pressure readings. The paired t-test showed a statistical significant change with a p-score less than 0.001, showing a significant decrease in blood pressure after the implementation of at-home blood pressure monitoring. The project has shown that the implementation of at-home blood pressure monitoring significantly reduces hypertension. Incorporating at-home blood pressure monitoring in hypertension management can improve patient outcomes and can be used as an effective aid in hypertension management. Some limitations of the project. So the project only compared one pre-intervention reading to one post-intervention reading. Having multiple readings can increase the reliability of the project, as well as help mitigate any fluke readings. As well as if the project was done over an extended period of time, that would have allowed patients to receive further patient education on diet and lifestyle changes, thus improving their hypertension management overall. Another limitation of the project was the provider's lack of motivation at the beginning of the project in educating patients on how to use the blood pressure monitors correctly. This lack of motivation also influenced the lack of education about other factors that help affect blood pressure, and also possibly affected the accuracy of these blood pressure readings that the patients were receiving at home. However, this limitation opened the door for a conversation between the providers at the clinic site and helped the providers discuss hypertension management and actually help unify us in how we manage hypertension at the clinic from this point forward. Implications. So for further future research, the project has shown that at-home blood pressure monitoring is a valuable tool in hypertension management. It has also shown that it should be incorporated into comprehensive care plans to help personalize treatment plans and improve patient outcomes. For future practice, the project has shown that through regular self-monitoring of blood pressure at home, patients feel empowered, and patients are able to help manage their hypertension at home and really be proactive in their overall hypertension management. This also has led to timely medication adjustments based on the at-home blood pressure readings and can help to reduce the strain that hypertension has on the overall healthcare system. For healthcare policies, the project has shown that there is a need for policies to promote patient education, further promote patient education and about diet, exercise, lifestyle, and some of the other changes that they need to make in their lives to improve their hypertension. In addition, advocacy for policies supporting hypertension management and empowering patient self-care is needed. In conclusion, my research question was, in adult patients with hypertension, is home blood pressure monitoring more effective than no home blood pressure monitoring? A comprehensive literature review guided the methodology of the project. The intervention that was implemented after approval from the facility and after approval from Maryville University. The project was a quantitative exploratory design using a retrospective chart review. And some of the key findings of the project were some of the strengths. The project showed that there was a statistically significant improvement in blood pressure readings post-intervention, and that it had a very large sample size supporting the reliability of the results. Some of the weaknesses of the project, there was a lack of motivation from the providers and patients in the beginning. Overall, the project has shown to have a positive impact on hypertension management, and the clinic site has continued to use at-home blood pressure monitoring in management of the patient's hypertension at the clinic with the patients that we care for at the clinic. For any questions about the project, please feel free to contact me at the following email address. And here are the references that I used for my project. Thank you for taking the time to listen to my presentation, and thank you for all of the help and support throughout this term and throughout the project throughout the DMP course. Thank you.